Hi everyone, it's Dr. Sam and we are at podcast 97. Welcome to the EyeClarity program and we have a great show today. I want to start off with an announcement that I'm going to be teaching an online course July 24th to the 26th, and I call it the Vision Sanctuary Retreat. And what I'm going to be doing is leading people in different protocols and processes to stimulate eye health and wellness. So if you suffer conditions like cataracts, glaucoma, macular degeneration, or you just feel like your eyes are getting worse and worse every year and you're feeling really frustrated, you don't know what to do, this would be a great opportunity for you to learn a more integrative approach to taking care of your eyes, vision, brain health. I'm going to be doing things like sound healing, light therapy, physical eye therapy, aromatherapy, and many other things. So I hope you can join me. If you're interested, you can click on the bio in Instagram, and I will also put the link on Facebook, and you can register through Eventbrite. So I hope that if it's something that you're interested in, you can definitely get a lot of information and experiences to make the changes that you're looking for. You know, I've done a couple of online classes. I did one in April and one in May, and they were incredibly helpful to people and very powerful, a lot of potency. So this is much more than doing eye exercises. It's very much a mind-body therapy that can really shift a lot of things. So I hope you can join me. Well, we've got two really interesting questions today, and so I want to take them. The first question is from a gal who has, I'm going to read this, she's got glutathione and B12 deficiency, which has caused her eye floaters. And she wants to know if there's a relationship between glutathione, B12, and her eye health. So in answering that question, I'm going to address glutathione first. And glutathione has been called the master antioxidant in our body. Our liver produces it. Sulfur is very important as a trace mineral that helps produce and support glutathione. Now it helps many different body processes, from immune health, detoxification, cardiovascular, but I want to talk about how glutathione impacts our eye health. So in one study that I've reported on, glutathione definitely helps support lens health. So if you're suffering cataracts, probably uploading more glutathione into your body is something that I would suggest. Now, if you want to get it through your foods, the cruciferous vegetables are a great source. Also, garlic, onion, leeks. These are things that contain glutathione, and you can also do a sublingual spray that absorbs into the bloodstream really well. So in terms of glutathione as an agent that chews up or eats up or absorbs metabolic waste, if we bring in the conversation of floaters, floaters occur in the vitreous part of the eye, which is our gel sac, which is made up of water, proteins, and collagen. So if we have floaters forming, a lot of times the reason is because the vitreous is not getting enough antioxidants to get rid of metabolic waste that's definitely accumulating in the vitreous gel. So my advice would be to boost your glutathione levels as a way to see if you can reduce the metabolic waste that's definitely accumulating in the vitreous. But what I know about floaters is there are many reasons why floaters occur, and there's no one magic bullet that gets rid of floaters. But I would say that a deficiency in glutathione is definitely a risk factor. All right, let's talk about vitamin B12. So in vitamin B12, this is a very common problem, especially in the elderly. Sometimes vegans can be deficient in vitamin B12 because our sources are mostly animal based, although you can definitely supplement with vitamin B12. So there's a relationship between vitamin B12 and blurry vision. So if you have, say, an onset of blurred vision, you want to have your B12 levels checked. In this particular case, again, with a B12 deficiency, it can affect the retina, the optic nerve. So if you've got a glaucoma risk, it can definitely be a risk factor. So to answer your question, yes, B12 can definitely be a contributing factor to floaters. So my advice would be in both of these cases, probably supplementing with glutathione and vitamin B12 could help clear up some of your vision problems. Again, we don't know for sure, but certainly there is a correlation. All right, question 2 is a question about freckles in the eyes. I love this question. So in the question, the patient is asking, is there a cure for freckles in the back of the eye? Okay, so when we talk about a freckle, this can be like, well, I would say the metaphor would be like a mole on your skin. And yes, we definitely have freckles at different parts of the eye, actually in the front of the eye. We can have it on the inside part of the eyelid called the conjunctiva. We can have it on the iris, and we can have it in the back of the eye in the internal lining. It's behind the retina. It's called the choroid. And what you're referring to is a freckle on the choroid. Now, the medical term is called nevus, Nevis. Bottom line is that 99% of all freckles that are in the eye are harmless. They don't affect your vision. But there is a small percentage where the freckle needs to be checked out because it could be a melanoma. And this is a cancerous situation. It's a serious situation. And so when you go to your eye doctor, if you've had a history of having these freckles, you want to have it checked. It's very important because if you're proactive, most likely it's not a cancerous situation. But if it is, then surgery is warranted, and it's a way for you to avoid any serious problems later on. Now, some other points about freckles is that this particular patient is asking, is there a way to get rid of it? Well, not that I know of, but that being said, I think proactively, it's always a great idea to steer yourself away from eye drops, if you're using those, that contain preservatives or chemicals, even pharmaceutical drugs. So if you're using more natural eye drops like similacin, Optique, those are the homeopathics, MSM comes to mind, Eyebright Tea is a compress, even castor oil, there's a castor oil eye drop that you can use. These are beneficial as a way to moisturize and hydrate your eyes. And disease tends to form in a state where there's more acid, and so it's an acidic climate. And if you're under stress, and including visual stress, if you're dealing with any kind of inflammation, both systemically or on an eye level, let's just say you put yourself in a position when you've got these kinds of things going on, that you're more at a higher risk of it leading to something that's more serious. I would add, make sure you're doing, some really great plant-based foods that contain the rainbow colors. I like to include the berry family in terms of fruits, making sure you're getting enough of the vitamin A, beta carotene. Your vitamin C is very important also. Things like quercetin, bilberry, the carotenoids, lutein, zeaxanthin, and astaxanthin. Very, very important. And of course, your trace minerals. Selenium is very important as it relates to glutathione, which, as I talked about in the first question, one of the best sources of selenium is Brazil nuts, as an example. So, the healthier you eat, the better your diet, and in making sure you're including natural remedies to your eyes, whether you're using eye drops. I would add one more, the blue blocker filter, if you're using digital devices, can be very beneficial at protecting your eyes from the damaging, chaotic blue light that's emitted from our LED lights and also digital devices. But I don't really know of anything specifically that gets rid of freckles. Again, it's mostly a benign condition, so as long as you get it cleared from your eye doctor, I think you're good to go. So everybody, I want to thank you very much for joining us today. It's always an honor and a pleasure to share information. If you've got questions, make sure to send them to me, hello@drsambyrne.com. My web store is open, so shop away. I'm going to be adding a few more products in the next couple of weeks, so stay tuned for that. And I wish you well, and until next time, take care.